Namaskar and welcome to the program. Our guest today is the eminent professor of neurology, Dr. Padama Srivastava. Welcome to the program, Dr. Srivastava.
Thank you.
And also the recent recipient of Padma Shri. How does it feel?
It feels great, top of the world. It certainly is a great experience. It's surreal almost. So yes, I would say that it was wonderful to have been chosen.
And that entire ceremony in those kind of regal surroundings, something special, isn't it? Like being a part of history.
Yes, it is. It was amazing just to be in the halls, the Darbar Hall, Akbar Hall. I mean, the first time I've entered those the glorious echelons of history, and it was like, and to be a part of that kind of elite, and to be recognized as part of that elite, it's I felt really it was a humbling experience that the recognition. Sometimes you feel that, do I really deserve this? And at the same time, it has given so much of a boost and confidence to do more, that yes, I can do this, I can achieve more. And after all, these are not the awards, it's just not an award in quotes for a person, it's for the country. So it means that there's a recognition that you're doing something for the country. Means it's a boost to be given that kind of push that yes, go do more for the country. So
but
great.
Somebody like you doesn't really need a push, because as it is, you've been passionately involved with your field.
Yes, I guess thank you for saying that. If in spite of all the issues, travails and tribulations which probably happen in every profession, but given a chance, and if you have to live life all over again or take a rebirth, yes, I would be a doctor again, because I think I'm very happy doing what I'm doing. So yes, the award is not required, that you don't need an award. Every time there is a patient who feels sort of relieved from whatever they've come to you for, that itself is a huge award. And you see, any profession where you go in and then you come back and feel happy about what you've done. It's not always that you are sort of successful in what you endeavor to be. So there are obviously situations where I feel extremely depressed, but then the effort is there. As long as the efforts have not been suboptimal, that gives a satisfaction, and it's a constant learning process, and you're dealing with human beings. I love that.
And especially the aspect of human beings that you're dealing with is unusual. When you're dealing with the mind, and the mind is not just the brain, it's the entire emotion, things which are not tangible.
Abstract.
Really.
Yeah, see, I know what you said is absolutely right. So they say brain is the final frontier.
Right.
Now that those issues, just you're bravely going to Star Trek. There used to be this thing, to go where no man has
been before.
So that kind of a thing. Yes, it's an exhilarating experience. And if you actually look at what has been, say, 5 decades ago to now, even when we first forayed into medicine as an MBBS graduate, to now, and being in this as a neurologist for more than 2 decades, there's a sea change. So what has been thought to be a science or a scientific fiction is a reality, and we can do more. So there's a brain which is looked at a great connecticome. So there's so much of biomedical engineering coming into the foray of biomedical science as in general. So there is it almost is like the limits are not there to what a human brain can achieve. So if you're looking at teleportation, or you're looking at, you know, flying in the sky. So we had our Mahabharata and Ramayana, where you had this people who are flying in skies, and we do have aeroplanes. So, you know, you're transporting these energies in Star Trek. You go and, you know, by mind
Teleport,
you get into teleport. So these look at like science fiction today, which may not be a few decades later. And we are looking at regenerative medicine. We are growing organs now using stem cell facility. I think science is advancing, so is neurology. And so yes, this field is dealing with both brain and mind. So yes, but then there are a lot of battles to be won still.
And yet, even today, it is said that we use barely a fraction of our brains, don't we?
Yeah, it is true that
Does that still hold true as it did?
There is a lot of areas of the brain we don't understand. So at this point of time, we think that we're not using them. We think they're in reserve. And so there are these functions which are extremely basic, and then there are those you know, the aspects which are much more advanced. So we have a superior intelligence, and we also have the basic understanding to survive. So there are several layers there. So those layers which are for a superior existence or a superior understanding of the universe, and be one with that and to better it. Now those are not frontiers which are totally well delineated. That's dealing with a conscience at a higher level, abstract, just, you know, judgment. So those higher cognitive domains are not taken as outcome measures in a lot of our diseases and, you know, disability and what happens when a disease strikes.
You know, for a doctor, most doctors have to follow the empirical truths when it comes to whatever their science is. Now, in such a scenario, when we take these quantum jumps towards consciousness and super consciousness, is it easy for you to deal with it?
Not really, because we are looking at, actually, we are not looking at an abstract. You see, I'm dealing with the brain. As a neurologist, we are dealing with a structure.
Right.
Whereas the psychiatrist or a psychologist is dealing with a more of the psyche, the mind.
Right.
Though there seems to be a spectrum now, and there's a continuum, that there is a structure as well as the function, and the psyche are actually related to a whole host of a bunch of neurotransmitters and neurochemicals, and an interplay with them and a balance of those. Having said that, though, we still have huge lacunae in our understanding of these. So at one point of time, we used to think that psychiatrist is something which you have, which you are just imagining, making it up. We no longer think that way. And also the same chemicals which are, say, responsible for something like a schizophrenia, are also the chemicals which are responsible for certain movement disorders, which you must have heard of, a disease called Parkinson's disease, or a cognitive disorder like dementia, Alzheimer's, and in a whole host of other neurological situations. So understanding is growing. So whenever you have to deal with a patient, it always has to be holistic. So it's never a person. Or, so there are two main things which has happened now. One, a personalized medicine. Say there are statistics, but you can't have one glove fit all approach. So a medicine which may help you may not help another person, given the statistics that largely it will help. So it's something called a personalized for you. As an individual, you're unique. So there are unique set of risk factors, unique set of clinical conditions. So that is one concept which is gaining momentum, called personalized medicine. The other is when you deal with a particular condition, whether it's neurology, cardiology, gastro, whatever, in spite of this tubular kind of visions that people develop whenever they go into super speciality, it is always better to have a team approach. So I'm not dealing only with the brain. I will also deal with the psyche. So I will have my psychiatrist on board. I'm also not only dealing with the brain as an organ. Brain is connected to heart, to kidney, to everything else in the body. Body, there's no compartmentalization. So depending upon what clinical situation it is, I have my own team. And the bottom line is, my patient should get better. It's not that the brain is better, but the kidney is not there, why the heart isn't functioning well. So these concepts are, have always been there, but there's more evidence towards it. And a further advance, you can always tell me to stop, Okay, so if the other advance is trying to get a holistic medicine involving all aspects of medical management, not just allopathy, because there are certain aspects which are best dealt with Ayurveda. There are certain aspects which are probably best seen only with yoga meditation. Always yoga meditation is an integral part of whole host of things.
Right.
Amalgamate all of them for a holistic best optimal management for that person. All these concepts are gaining ground.
And it is wonderful that doctors are now being more open-minded, because mainstream medicine has always been very insular and has always dismissed what is Indian traditional medicine, hasn't it?
I really don't know. You see, the traditional medicine, or we should not say unconventional because, or alternative, I think they're not even complementary. They're systems.
Yeah, they're systems.
And they have actually stood the test of time.
For thousands of years.
Also the Western. And we have similar such, medicines being developed across the world. It's not just India or Ayurveda. We have the homeopathy, we have the Chinese, we have the Tibetan, and you have the Unani. And when you actually get into it, though I'm not expert in any of these, I can't even claim to be an expert in my own field, but you look at the good things in each one of them, they're amazing. And when you look at the principles of Ayurveda, and there are a whole lot of it which sort of there's overlap between them. And when you look at it, yoga, and come to think of it, yoga is a way of life.
Right.
Yoga is not panchakarma, yoga is not just asanas, yoga is not, it's a way of life. And when you look at that way of life, you automatically start believing that yes, and this transcends religions.
Right.
This transcends, in fact, all systems of science.
Very true.
So and we have a rich tradition of that. We should, and I think the current mandate also seems to be a whole lot of emphasis on this, and I'm very happy that, and I'm feeling encouraged that these systems are getting their recognition.
And a lot of things that we normally say, since you mentioned all the other organs, we talk about reasons why people get heart attacks, lifestyle, pollution, bad eating habits, etc., and stress. Now those are also related to the brain. So one can easily get a brain stroke, or what you call the brain attack, as easily as a heart attack for the same reasons, isn't it?
True. In fact, when you say brain attack or stroke is the second commonest cause of death currently.
And it's becoming an epidemic in our country.
It is. In fact, India is witnessing a stroke epidemic, and simply put, the stats are that every 40 seconds there is a stroke, and every 4 minutes there is a stroke death. And the Indian Council of Medical Research statistics for the year 2010 was itself 1.65 million strokes in India. So it's huge. The stroke statistics are truly, truly staggering. It's humongous. But then, when you're looking at a preventive module, there are two aspects to it. When you're looking at a preventive module, you're looking at controlling the risk factors which are predisposing towards a brain attack, are the same risk factors which are predisposing to heart attack, the same risk factors which are predisposing to a kidney problem. And when you look at what are called as non-communicable disorders, which are actually being a lot of thought, lot of input. In fact, there's a fight stroke program, there's a fight NCD program launched by the government of India for some years now. And what has been seen is, yes, you be good, live a healthy life, bottom line, but it's so difficult. You think the person who's smoking is doing that because he doesn't know smoking is bad? It isn't.
Right.
The person who's consuming, say, alcohol, thinks that I can control with this one small peg. Now that is the power of the brain. You can't control it. You don't know the power of the brain. The brain is the one which I think is actually, it lulls you into believing that it's given you a control. It can't. It's the most amazing computer we have. No one could actually decode this. So the risk factors, a lot of lifestyle disorders, obesity, you keep doling out advice, and then you keep saying that, okay, you eat vegetables, you eat fruits, you don't do this, you do that. The things, these are being taught at a level of a primary school. It's not that we're not exposed to these truths, but we don't take it because we believe that the problems will always happen to someone else. It doesn't happen to me. I know how to control. I know where to draw a line. I will do it tomorrow. Today is different. I know I can deal with this tomorrow, and you will see me a changed person after 10 days. So it's always a belief that you have a control over the situation till the event happens. And the events don't come and happen. They are not going to tell you, they are not going to give you, very few times they give you an advance notice. Most of the time they are like a lightning strike. So stroke is sudden, heart attack is sudden, and obviously most of other disorders including cancer, they may creep up. When they do, they then progress extremely rapidly. There's no time. So therefore, besides preventive modules, besides say control of blood pressure, diabetes, giving the certain kind of medications which should be obviously available free of all to everybody. We can talk about that a little later. Right? But then we also have to have modules where while we are controlling these diseases, we will continue to see heart attacks, we will continue to see brain attacks. So therefore we have to deal with them as well. That is where we need more awareness amongst public as to reach out in time, go to the right place for the right treatment, and that's one of the mandates in the healthcare delivery systems.
And there is something that you have initiated,
yes,
Code Red.
Yeah, Code Red was something which we started ages ago. In AIIMS is the first public sector hospital to take up this thing called thrombolysis. It's basically, there's a clogged artery, you need to unclog it, and you need to unclog it ASAP. Time is brain. Every minute which elapses while the blood vessel remains clogged, you have zillions and trillions and billions of all these neurons which are dead and gone forever. So for them to prevent that from happening, you need to unclog it. It's like a plumbing action. So for that there is a drug available which you can give intravenously, and it can be given in emergency setting. So in that we started, AIIMS was the first public sector hospital, and we made it actually free. We launched that. Now of course the whole country does it. My mandate is that it should be given at every nook and corner of the country. You see, strokes are not happening in around metros, they're not happening around AIIMS, they're happening in Timbuktu, which would take you about 24 hours to reach Delhi. Now brain is not giving you that time.
Right.
So that treatment needs to be there in Timbuktu. So, and one of the main, like the workhorse for management of strokes is just a plain CT scan. So wherever, whichever district hospital level, wherever there's a plain CT, there's a CT scan facility available, there in the emergency service, we initiated these programs so that the person will get trained to recognize the stroke and deal with it, and also made this drug free. So that's also the government's mandate, and it's been a successful launch in several states currently, and the district level, just physicians who are trained in the stroke medicine are able to deal with it. I'm very happy in that, because but there's a whole lot of work to be done more, because we need to get the whole country into this.
Now the thing is, there are certain thumb rules. If somebody has a heart attack, that people know about. If you're getting pain on your left side, it could be a heart attack. If you're feeling breathless or acidic, it could be heart attack, so take action. Is there any such thing about stroke that if you have these symptoms, it's best to run to a doctor?
Yeah, very true. So, how to recognize a stroke, as you rightly said. Chest pain, breathlessness, even a little child would know that this is an emergency. It could be something to do with the heart.
Right.
And for a brain attack, even till date, unfortunately, a lot of people don't know what it is. I mean, they would always equate a brain attack to a sudden paralysis of one half of the body. That's it. But they would not think that sudden loss of vision, sudden loss of a speech, sudden talking gibberish, unable to understand,
or
slurring, or there is a balance, sudden disbalance, sudden vertigo, sudden very severe headache and loss of consciousness, or even a seizure, could also be a variety of a brain attack. So we say that sudden, that's the key word, suddenly losing a function. It could be a brain attack. And if you think it is a brain attack, even if it is a false alarm, just reach out as an emergency, don't wait. So for that we have these mnemonics which have been described. One of the most famous mnemonic is FAST, F-A-S-T, which has also been converted to Hindi, because it would be much more understandable by the population in different geographical areas. But FAST essentially means F is face. Whenever you feel that there is a facial asymmetry suddenly, A is arm. So you ask a person to lift up the arm and the arm goes down. S is both. You can ask them to smile so that you can have a facial dimension. Otherwise, S is speech. Make them talk, as you said, slurred or unable to understand or no speech at all. And T is time. Time is brain. Now this doesn't actually pick up all strokes, but largely for a lay person, for an emergency ambulance system, because we do have 108 system which is functioning in a lot of states in the country.
Right.
So for the ambulance, the paramedical personnel, they pick up this. And then when you have a map of the stroke centers, wherein you have this, it's just like a golden hour in a trauma map. Like if there is road traffic accidents, you know that.
Right.
There's a golden hour and they quickly rush to the closest and the most optimal trauma center. That's how the ambulance drivers are also trained. The same thing, we're tweaking this program to get brain attack into it.
But why have you not disseminated knowledge about it? Because it's not common knowledge. Is it still stigmatized? People still
No. It's not stigmatized. It is essentially, the stigma is for other neurological disorders like epilepsy and all, not for stroke. Stroke or a brain attack, people know it's an emergency, but it's been essentially this awareness issue of picking up an attack. I'll give you an example. Very often we have, a diabetes. Diabetes is actually again a real epidemic. 1 in 5 have diabetes. So there's a 60-year-old lady, she's a diabetic. So then she suddenly is noticed, say, right-sided tingling. So she would think, what would she think? Oh, maybe my sugar is low. And very often it is. It's a stroke mimic. Hypoglycemia will cause focal deficit. So she will take a glass of glucose. She goes to bed. And say 3 hours later or 2 hours later when she wakes up, she finds that the right side is paralyzed. So she's lost that time, 3-4 hours. And then a lot of times they are alone. And then she waits for her son to come back from the office. By then it is about 6-8 hours. And once the son comes, a lot of times they feel that this is as you said, a lot of people think it is a brain stroke and a heart stroke. There's nothing like a heart stroke. It's a heart attack. It's a myocardial infarction. Stroke is a stroke is a stroke. Stroke is to do with the brain. So they will go to their general physician or a cardiologist who may not be equipped with the stroke management, and then they are sending to someone else. What is happening is that time is being wasted. So if the person recognizes this as an emergency and the son recognizes this as an emergency and has a map where to go in at that particular point of time to get optimal management, and this is being practiced across the developed world, and there's no reason why we can't do it. We are going to be a developed world. So, and this is being implemented, and as you said, yes, awareness is a huge lacuna.
And awareness not just with the public at large, but also with the medical personnel.
Yes, true.
So the trauma centers or even the GPs should be aware of this as an option. That's not happening.
Totally agree with you, and
that upsets you.
No, but we're making progress. See, let's look at the positive aspects as well. Yes, there's a whole lot of ground to be covered in this. But I'm happy a beginning has been made. It's been made, and a progress. In fact, the first publication of our experience has also come out a month ago. You see, you need publications because you need to have it in a index journal for people to recognize that this is authentic data. Then they, when you provide data, even government listens to you because they need evidence.
You said, since we don't know how the brain will react or which part responds to what stimulus, is it possible that the same stimulus in one person will create a heart attack, with somebody else it would be a kidney failure, and with someone it could be a stroke or some other brain related or neurological problem?
See, this is where the genes come in, and as well as what we talked about earlier called personalized medicine comes in. let me give you an example. There's this is often quoted by a very good friend of mine who's also a top neurologist. What he says is that there's a Mr. Lucky and there's a Mr. Unlucky.
Okay.
And you have the same risk factors, okay? Blood pressure, diabetes, and they've also had a heart attack, and there's some smoking, okay? There is risk factors are there. So the Mr. Lucky has what is called as a lacunar stroke. That means there's a 2 millimeters area of brain which is damaged. It was like a warning. So he had a little weakness and then he recovers. So it was a warning. So he took, a note of what's happened. It was a real wake-up call for him. Stopped smoking, took care of his diabetes, took care of his blood pressure, and lived a comfortable and socially productive life for, say, 30 years. Then there's a Mr. Unlucky. So this Mr. Unlucky also had diabetes, also blood pressure, also smoked a bit, so had a heart disease. But then the blood pressure suddenly rose up, the blood vessel ruptured, he had a massive bleed in the brain. He survived but had a complete hemiplegia, has been bedridden, was, from a caregiver, he completely was dependent on his family for caregiving. The family had no support system, the family got wrecked and they became poor, so it had become almost like a kind of a destitute situation, extremely tragic, and we see these situations. Now, why did this Mr. Lucky have a lacunar stroke? Why did this Mr. Unlucky have a hypertensive bleed? Really no one knows. But it's been said that there are a lot of genetic factors which interplay, and also the extent and the severity of risk factors. Maybe the blood pressure control. BP is one of the biggest risk factors for all of these, even for a stroke recurrence and stroke outcome and what have you. So, but when you ask me that, why does someone have a heart attack? It's always said that a heart attack begets another heart attack, stroke begets another stroke, but nothing sacrosanct about this. A heart attack can have a brain attack, and these people have a lot of silent events happening. And also kidney, don't forget a kidney which is also there. So, and it's not just an attack, we're also looking at the brain functionality. A lot of times there's silent things happening. Silent heart, silent brain. Heart and brain are very intricately related. And the person subtly is changed. The personality is changed. They slowly, the people realize that they are decreasing memory, they're not as judicious as before. They have this anger outbursts, or they have aggressive, or they become more apathetic, they've got depressed. So people think they have more of psychiatry issues. So all these cognitive problems, vascular cognition, and Alzheimer's dementia, is one of the commonest dementias we have, which is also growing in numbers.
Are you fatalistic by nature?
Yeah, I believe in destiny. I believe hugely in God, hugely. And I do believe that every action has a reaction. And I think what goes around will come around. I believe in all these things because even when I'm dealing with science and evidence-based medicine, having all these in balance, I also know that when I'm dealing with a patient, I'm dealing with a lot of unknown factors which are beyond science. The other thing which does strike me, and I'm increasingly coming to believe in this, is that there's something called psychoimmunology. So when I believe in a doctor, somehow the doctor's things work for me. The psych, that I think I automatically start producing the right kind of endorphins, the hormones, or endorphins are feel-good hormones, the neurotransmitters or whatever it is, which actually tackle the problem. So there's a emphasis on, it's not just psychoimmunology, there's psychopharmacology, where a drug acts when you believe the drug is going to act. So
the placebo effect.
So it not so much a placebo, you see there are some people wherein you write side effects which are in fine print, they happen. So why does it happen? So that's again we're coming back to personalized medicine. But psych is important. So belief or faith. So when you're looking at certain systems like faith healing, prayer healing, maybe they have some science. So in fact what I feel is take good out of each science and make it into a grid for a person and then deliver it for an optimal outcome. So I believe that in every system there is something which is true and something good. So we shouldn't denounce anything and everything, wherein I will never say that my system is the best at all. If I say that, then I don't think I'm being foolish. In fact, I'm being foolish because I don't have all the answers. But yes, if there is a road traffic accident, the person is not going to sit and do yoga. The person will go immediately, will have to do surgery. The time is an important factor. In the recovery phase, to deal with a situation, I will definitely say do yoga, do meditation, and there may be other systems like Ayurveda and others which will take care of his biological systems, to taking care of his gastrointestinal system, no constipation. There's so many other things which would be important. So each system has something good about a certain aspect. The trick is to amalgamate all that.
You yourself are both a caregiver and of course you're a doctor. So you've seen patients from all points, really, the entire spectrum. How do you think that makes you more sympathetic towards your patients?
I think a doctor is a healer. So I don't believe that a doctor can ever be, not sympathetic. A lot of times, you steadfastly try to remain unattached, because sometimes your judgment towards a medication gets clouded if you get attached, which happens.
True.
And people try to not to do that, which I do believe you may need to do that. Now, when you talk of a caregiver, yes, I'm a caregiver. My mother is advanced Alzheimer's. She is my big baby. In fact, I'm the only child, so she's taken care of me. I'm here, what I am, because of her, and she's my baby now. So when a mother, working mother, when she goes back home, dreadfully tired and terribly irritated with a host of things which may have, but then when there's a little child there, and the child is, putting out the arms, to be, taken into the lap, the mother actually forgets a lot of, and I'm sure you'll agree with me on this.
100%.
That's exactly what happens to me when I go home. Now she is very demanding in the sense that all her needs I need to take care. But even so, when I go and I'm doing things for her, I clean her, I brush her, I do everything, and she's my baby, I'm changing her clothes, I'm doing that. I actually get so much of a satisfaction just doing that and being with her. So she just, I say, it's a mother-child, it's a role reversal. So yes, caregiving need not entirely be stressful. Sometimes it is. I will not say it's honky-dory and it's all going to be roses. No. But then if the
just
basic
like you have
attitude,
cantankerous children, you can have a cantankerous mother as the child, or the elder as the child also.
Yeah, and these elders do become children, and it is, you see, if we don't take care of them, who will? And I don't know what happens to generations to come, how they're going to behave with their elders when the time comes, because the world is competitive and you can't put demands on the kids now because they're flying.
Yeah.
They have wings and they need to fly, because the concepts are also changing as to how to survive in this universe itself. It's changing. Having said that, at this point we are living currently in this time, I can do this, I can manage, and I will do that. Again, there are no straight answers. There are no straight answers, because I, as an individual, my life would obviously not be comparable to someone else, and we can't draw parallels. And the most important thing I think here is we can never be judgmental as to how another person is dealing with, his or her stress or life. But again, these little rules of thumb may help, because they help me, is that you need to make your home a haven, because you need a resting place for recuperation, and I think that's a loaded statement, because it transcends a lot of factors, and it's just not physical.
This is very interesting what you're saying, that looking at the truth of life like this, especially certain kind of conditions like epilepsy and all, which people they don't like to admit that these things exist, and it has a whole lot of social repercussions. despite that, there are very few neurologists in our country. Hardly less than 2,000.
Yeah. For a 1.2 billion population, yes, there are 2,000. Yes.
Why is that so?
No, epilepsy is probably one of those neurological diseases where there's a lot of stigma, unfortunately, still attached. In spite of so much of social awareness, in spite of so much of education to lay public as well as medical, paramedical personnel, there's a big treatment gap. See, whenever there's a disease onset, there's a fever, you immediately run for a treatment. When there is an epileptic attack, people don't do that because there's a stigma.
लोग सोचते हैं कोई देवी आ गए या भूत चढ़ गया,
कोई भूत प्रेत आ गया है, वैसे ही ठीक हो जाएगी. अगर हम बताते तो कौन शादी करेगा, कैसे प्रेगनेंसी में क्या होगा, बच्चों को हो जाएगा, जेनेटिक डिसऑर्डर है, कौन मुझे एम्प्लॉयमेंट देगा, ऑक्यूपेशन का क्या होगा. स्कूल्स में डिस्क्रिमिनेशन कर लेते हैं. सो दिस डिस्क्रिमिनेशन इन स्टिग्माटा विल एक्चुअली वाइडन दिस ट्रीटमेंट गैप, विच इज़ वेरी वेरी अनफॉर्चुनेट, क्योंकि एपिलेप्सी कंप्लीटली कंट्रोलेबल. 75% प्रतिशत में तो पूरी तरह तो ट्रीटमेंट ही हो जाती है उसकी.
अच्छा.
तो बट सही वक्त में सही ट्रीटमेंट शुरू होनी चाहिए, एंड दैट डजंट हैपन, एंड विच इज़ वेरी वेरी अनफॉर्चुनेट. बट देन उसके लिए भी there's a lot of effort, there's a lot of emphasis. In fact, a lot of bodies now, the societies are working towards it, and I think for a large extent this is being tackled.
तो एपिलेप्सी क्या मैनेज होती है कि क्योर होती है?
एपिलेप्सी आप अगर बहुत अच्छा क्वेश्चन है ये. इनफैक्ट मैं उल्टा सवाल पूछूंगी. आप एक डिसीज आप बताइए जो ट्रीटमेंट क्योर हो जाता है इन्फेक्शंस के अलावा. जिस्म में आप ब्रेन का ही छोड़ दो, आंख, हार्ट, लिवर, किडनी, व्हाटएवर, इन्फेक्शन के अलावा कौन सी चीज है वो क्योर हो जाती है?
कोई भी नहीं होती.
कोई भी नहीं होता. सब चीज कंट्रोल ही तो होता है. सिमिलरली एपिलेप्सी भी कंट्रोल्ड है. तो इनफैक्ट लॉट ऑफ, जैसे आपने पूछा, लॉट ऑफ फैमिलीज पेशेंट्स भी यही कहते कि हमारा डॉक्टर साहब एपिलेप्सी कभी क्योर होता भी है. तो हम तो यही कहते कि नहीं, ये तो कंट्रोल्ड है. और 70-75% ऑफ द टाइम्स हम अगर 3 साल कोई दौरे नहीं पड़ा, उसको कम करके दवाई बंद भी कर देते हैं. तो वो देखे तो वो एक तरह की क्योर भी है
जी.
तो ऐसा नहीं है कि इसमें होप नहीं है, एपिलेप्सी आ गया तो कुछ नहीं हो सकता. ये गलत फहमी है. In fact, I mean, a lot of, unfortunately, neurological disorders, a lot of concepts are totally baseless, बेबुनियाद है. This is one such.
ब्लड प्रेशर देखिए, अगर किसी को ब्लड प्रेशर है तो रोज की गोली तो खानी ही है, वो भी तो मैनेजमेंट ही है.
Exactly. And then what they say, lot of times they come back and say कि हमारा ब्लड प्रेशर था, हमने डॉक्टर साहब ने एक दवाई दिया, हमने खा लिया, ब्लड प्रेशर ठीक है, हमने छोड़ दिया. So it is so naive to think that continuation of a drug, ये तो एलोपैथी है, ये गरम दवा है, गरम करेगा. Now this is often said, which is the biggest mistake, because hypertension is a silent killer.
Right.
ये कभी नहीं सोचना कि सिर दर्द है तभी तो हाइपरटेंशन है. नो, हाइपरटेंशन इज अ साइलेंटली इट डैमेजेस. तो अगर बीपी के लिए कोई दवाई ले रहे और बीपी कंट्रोल्ड है तो दवाई कंटिन्यू करना है, अनलेस अंटिल कोई प्रॉब्लम हो रहा है. प्रॉब्लम हो तो आप दोबारा अपनी डॉक्टर के पास जाना है, कंसल्ट करना है. डॉक्टर साहब ये इसके लिए मुझे ये इश्यू हो रही है, then they will either change it or drop it or whatever, but खुद नहीं करना.
आपने सिर दर्द की बात की. दैट ऑल्सो इज वन ऑफ योर एरियाज ऑफ स्पेशलिटी और रिसर्च और इंटरेस्ट इज माइग्रेन्स.
माइग्रेन मैम इज द कॉमनेस्ट कॉज ऑफ हेडेक. पर अगर हम हेडेक की बात करें, दैट इज द कॉमनेस्ट कंप्लेंट ऑफ मैनकाइंड. अब मुझे नहीं पता अगर एनिमल्स को भी हेडेक होता है या नहीं, मुझे नहीं पता, पर ये कहते कि जिसको हेड है उसको हेडेक हो गई. सो अगर माइग्रेन ले तो माइग्रेन इज द कॉमनेस्ट कॉज ऑफ हेडेक.
बहुत लोग कहते हैं कि औरतों को होता है, दिस इज जस्ट एन एक्सक्यूज टू get out of work or something.
Well, we shouldn't condone that. We shouldn't agree on that, because migraine happens in 20% of population. Right. 1 in 5. I have migraine.
Okay.
So the migraine goes sort of, you see, all of us have headaches.
नहीं.
कभी हेडेक हो गया, लंबा सफ़र कर दिया, हेडेक हो गया, उस दिन नींद नहीं आई, हेडेक हो गया, कुछ उल्टी चीज़ ही जो सीधा खा गया, हेडेक हो गया, गैस बन गया, हेडेक हो गया, किसी की सूरत पसंद नहीं रहा, स्ट्रेस हो गया, हेडेक हो गया.
तब तो ज़्यादा ही होता है.
तो headache triggers are innumerable. Most common trigger is going out into the sun. सारे दिन धूप में रहे, हेडेक हो गया. उस दिन खाना नहीं खाया, लेट हो गया, हेडेक हो गया, हाइपोग्लाइसीमिया. So these triggers do cause headaches. It is actually a disease process by itself. It's very common. तो इसमें अगर बार बार हेडेक्स हो रहा है, हम बहुत ज़्यादा पेन किलर्स खाने की ज़रूरत पड़ रही है, then we need to put on prophylaxis. There are certain drugs which we give. But most importantly, for migraine or any of these headaches, we rule out other causes which are sinister.
Right.
But largely, if you take 90% of headaches in general are primary, and they're not dangerous. They may be a nuisance, but they're not dangerous.
And headaches are really symptoms, not the disease.
Headache is a symptom, dizziness is a symptom. But when you look at a migraine is actually a headache disorder, which is a disease by itself. But yes, as you rightly said, headache is a symptom, just like giddiness, dizziness, backache, neckache, pain. Pain is a symptom. It indicates a problem, but pain by itself is a symptom.
कुछ बात करते हैं आपकी करियर की. एम्स में तो 60 से न्यूरोलॉजी का डिपार्टमेंट है, but you were the first woman in the 90s, almost 30 years later.
No. See, in fact, no, I was certainly not first woman at all. In fact, neurology is woman dominated. Really? Yes. And we have a lot of extremely illustrious women who had held the department and also have been the HODs. In fact, we had Professor Vimla Virmani, who in fact who's initiated it, and she's been etched in the echelons of the history of neurology in AIIMS. But what I feel very proud about my department is continuously for more than a decade, it's been rated #1 department of neurology in the country. Okay. By the ratings. It's got published in India Today and other the journals and the other magazines. And what it's very heartening to see that you've been just the best, because we do have lot of services. So you give a very comprehensive approach to a patient. So somebody is good in stroke, somebody is specializing in epilepsy, somebody is specializing in movement disorders. So all aspects of neurology have been developed. And so we have a research arm, we have an education arm, we have the service arm. So true to keeping with the mandate of All India Institute, I think this department is, I'm bragging now, but I feel good about it. Yes.
And why not? You've been involved both in research as well as teaching, haven't you?
Yes. Teaching bedside every day. In fact, I just took a round. I'm on service these days. I just took a round and my poor residents were at a receiving end for some reason today. Not that I don't want to yell at them. I don't like yelling at them. But yes, it's part of teaching, and my students are like children. Yeah. You see, this is a lifelong association. Even when they pass out and they go into different, the geographic areas in the country, in the world, we maintain this, this umbilical cord connection is there. So I'm not their parent, but I feel I'm their parent. I really want them to groom, and I feel very proud when they go out and do something, which is much more than what I thought they would do. When they excel, it gives you so much of pride. I want that to happen.
And what about your teachers? Are you equally connected with them?
Yes. And I think, last year we had this neurosciences alumni think of being there in several decades. And so it was kind of honoring the elders. So we had this, and in fact I presented sort of what you call, those who have left this world and went away. So we had sort of in the entire neurosciences, not just neurology, neurosurgery, neuropathology, all them. And when I was going through the historical records, because some of them I even haven't met, and they're amazing people, because to achieve in those areas where science didn't progress so much, and still be able to deliver optimal care and relief to a patient who's suffering, I think it's amazing. And then develop those research realms where those foundations were made there.
Yeah.
So yes, my teachers are my Guru. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara. Guru Sakshat Parabrahma, Tasmai Shri Guruven Namaha. Yes.
Yes, we all bow to your gurus for creating such a work of art where neurology is concerned. What keeps you going? कभी ऐसे लगता है, why am I doing this? Why not something else?
Oh yes, I do feel that. I mean, there are times, I think just a couple of days ago I was telling my husband, I'm going to take sannyas and I'm going to go to Himalayas, you know.
Okay.
There are, you know, these are human aspects.
Right.
You have to let off steam. It would be extremely uncommon, and in fact I would say not superhuman, inhuman, not to feel anything. Emotions are integral to our life, to our living. So yes, I do feel that frustrations are part of life, but then what keeps me going is a tomorrow.
Yeah.
Sun will rise, there is a tomorrow. I will be going to my ward, I will be looking at my patients. That drives me, and I'm coming back to my nest with all its problems, but it is still my nest. So I think it's a sense of belonging to whatever you're doing which will keep you, you know, going and achieve. Whether you achieve more or not is an immaterial thing. As long as you feel belong to your purpose, your passion and your people, that will keep you going.
That's beautifully said. The need to belong and to find a place to belong to. Thank you so much for being on our program today and sharing your life and wisdom with us.
Thanks.
Thank you.